All right, well, we'll go ahead and get started, and I think people will kind of trickle in as we go here. I just wanted to bring us all together. It's super casual, little town hall, just so that we can be ahead of the game in our case reports, making sure that we're all clear on the grading criteria, the expectations, how to write, what you're writing, ask any questions. And today we have Dr. Diane, who's our immediate past president, and also on the certification committee, here to answer any questions. And our certification committee chair, Dr. Heidi Cooley, is on as well. So they'll be able to really help guide us with any questions or concerns that we might have. Hey, Heidi.
I would just start with some of the things we discussed just a little while ago about the case study and the idea that this is a really good exercise in putting everything together of what you've learned in a real life scenario. I know when I did it, you know, there's times where I know one of my cases, I knew from the beginning when I was doing my coursework, like I needed to figure out what case I'm going to do. And when I had cases, I tried to identify them. My second one was harder and I had to go backwards kind of, and it was much more retrospective studies. So, you know, those sorts of things. And I don't have a master's degree. I didn't go to graduate school after vet school. So the idea of how to do that kind of research paper, I think there's, you know, looking at the rubric, there's a breadth of ways to do it, from a Veterinary Today article that goes through a case and what happened and what you would do, to a true scientific thing that you could submit to a peer related as a case study. So we really, you know, tell you guys, like, go look around, like, you know, there's a ton in PubMed, there's a ton, you can just Google veterinary case studies and, you know, looking at frameworks, seeing what works for you. You know, we have the idea of what needs to be in there, but there is a way to personalize it or make it at the level that works well for you. So it's like an essay of everything you learned and how you would use it in a pet, but broken into a much more scientific format. So that's kind of my 2 cents.
So how about what I think might be helpful is, let's just start off with, I'm going to share my screen and go over the rubric, the grading rubric with everyone. So can everyone see my screen?
Hey.
Great. So this is the grading rubric that all of the graders will receive when they are assigned your paper. Everyone's papers are assigned anonymously, so that there's no conflict of interest, or, you know, grading your best friends or otherwise.
They're best friends now.
It's entirely anonymous. So you can see it's graded on 100 points in these different categories. So you'll have your cover page, discussion, summary, and references. So that's really just the bread and butter of the entire paper. Okay. And then full signalment, the history, and then the psychosocial needs, which you'll see are broken down very, very, very detailed in the below part of this rubric. So all of you received this attachment in the email that I sent out. So this is for you to kind of go off as well, so that you can make sure that you have everything in your paper that's required. Down here are the guidelines and a checklist. So I would recommend printing all of this off and just checking them off as you go. Formatting is all right here. So this needs to be in a Word document, Times New Roman, size 12, 2,500 to 3,000 words, double spaced, and pages must be numbered. And then you'll see down here, we even broke down what each of these requirements consist of. How many words, what to include, from the gender down to all of the physical abilities and all of the care that were provided throughout the case. Any questions on the actual guidelines themselves?
So if it's a case that's sort of already completed and maybe you don't have contact with that patient or client anymore, and maybe you don't have all of those things identified, like all of the psychosocial needs and different things that are in that category, do you just sort of make assumptions in kind of remembering back the closest that you can recollect psychosocial needs are and include those?
That's a great question. And I think that also goes into another common question that I've heard. If Heidi and Diane wouldn't mind helping with the answer to it is, what if you didn't do or didn't see X, Y, and Z of those requirements? You know, what if pain medications weren't given. What do I do? So that's a really common question that plays into your question, Nancy, of, how do you, in retrospect, go back? Do you go back? And how do you explain that in a case report?
And I don't know that you even need to mention, like, I mean, I don't think you need to type, I don't remember. I think you need to type, in these situations, in this type of case, this is the typical psychosocial needs of an individual going through this. So you can absolutely go into your training and say, like, this is what we expect them to have. In this case, if in this case, we did recognize these needs. And here's some, maybe we didn't, I would, if I had to do it again, or if, in the case, we could have improved upon addressing X, Y, and Z. Because honestly, if you didn't remember it, you likely didn't do it. But, remember, like, some cases we're doing, it's how you would do it. So, there's not everyone who goes through an algorithm. So it is a matter of, what you did and what you would have done and what's typical of the case. So you always kind of think of those three things. And I'm sure Diane, being a grader for years, also has some insight.
Pretty much the same thing, Heidi. I mean, it's just, we're learning how to be better hospice palliative care practitioners. And so obviously coming out of this program, the odds are we're going to handle a case differently than a case we might have previously managed, or an associate or, a colleague has managed. So there are going to be things that weren't done that you now know should be done. And so where appropriate, you'll include that in your discussion of the case. So don't worry about if it wasn't a perfectly managed case, because you're going to demonstrate what you've gotten from the class in critiquing, in a way, the management of the case, to show exactly what Heidi said, where, what things would you now, could have been considered that weren't considered. Aspects of things like integrative care that often isn't incorporated into a lot of cases in the average, let's say, brick and mortar practice. And you can say that in a case like this, these are some integrative care options that could have been considered.
Yeah, and I think that the clarity that comes out of this is not grading how you manage this case.
Mm-hmm.
This is grading your analysis of how the case was managed. So we are not grading like, oh my God, they did this, this, and this, and that was horrible. Like, this case could have been totally mismanaged, which actually would make an awesome case study of, like, here's a case I did 2 years ago before I even knew hospice existed. And holy moly, like, here's all the things we would do. So this is not grading your value as a veterinarian or how you did it. This is taking what you've learned and applying it in a real life scenario.
I know we have some technicians on the call. I've had some questions by email asking, if I'm not prescribing the medications, then how do I list those medications, or how do I list, because as a technician, we might now know after the program that maybe X, Y, and Z medication would have treated which symptoms. Is there, Diane and Heidi, a best practices way for a technician to explain that without sounding like they were to have prescribed it or would have prescribed it?
Are you referring to where maybe adequate pain management wasn't provided, and since a technician wouldn't be the one that would originate that, how they would discuss it? And I would think just the basic concept of multimodal pain management could be introduced in a discussion. And our students have learned, because of the in-depth nature of the pain module, different types of pain medications and how they can complement one another. And so even if you're not prescribing, largely the reason why technicians take that module is so that they're understanding what the veterinarian is prescribing, and also aware enough to know that maybe additional medications would help a patient. So
Perfect.
I know that they're not prescribing, but that doesn't mean that they shouldn't be aware of the fact that you're going to often layer medications.
Well, and I think that's the other thing is in our training, the triad, the client, the technician, the doctor, the family, like, I would phrase it if I was a tech in, discussing amongst here's what I would bring up in discussion, to the doctor, or when we're having pain management questions, like, I think, these are what I would expect the doctor to prescribe, or I would want more detail on.
Mhm.
So I think we're a very good community of, I shouldn't talk, but I feel like the hospice veterinarian community is very respectful of their technicians and very open to their contributions and their abilities. So, if it was any other general population, I'm sure it would come across differently, but I do think the value and it may be reporting back, like as a technician, I evaluated the pet's comfort, and during nursing care, I found that there was need for me to inform the vet so that we can reassess and have a new pain plan. So I think that's where that value comes in, as the kind of hands on the pet most of the time.
Absolutely, Heidi. And if, you're a tech and you're writing exactly what Heidi and Diane were saying, and also, tell the why would a different medication or a different dose of a medication have been helpful to the pet? What did you visualize? What was the pet exhibiting? What scale did you use? Whether it was a pain scale or a quality of life scale, being as painfully detailed as you can about your why, I think is important as well.
There's so many times when I was in practice where my technicians kept me from getting into trouble, like on a busy day with all the things that I was juggling, because you know how technicians and doctors are pulled in a million directions on a typical day. And when I had a technician that could remind me of something, that might help me in a case like this, where it's a long, convoluted history, but a technician was astute enough to maybe pick up on something that perhaps I had overlooked. I never felt they were overstepping and trying to tell me how to practice. I really felt that they were complementing what I was providing. So again, it maybe don't have a license to prescribe, but they can certainly evaluate care if they're what we consider a certified hospice palliative care technician.
Absolutely.
There's a question in the chat. Is it okay if I address it?
Go for it. Yes.
Yeah, well, I'm pretty sure only one person grades papers. If we end up with a paper where the grade isn't it may mean the student's not going to pass, then I think Danielle will probably ask a second reviewer to review it before we would notify the student of that, to just make sure we get two different perspectives.
Mhm.
But I think, to my knowledge, that may have happened once last year. It doesn't happen very often. I can't even remember it happening ever when I was chairing this committee. So in general, one person is the only eyes are going to be on your paper, but it's all anonymous. So we give the students a number so that there's no possibility of any impartiality.
Yeah, they're just the first one may be in the style guide. When you're speaking now, but people are speaking, they're talking about saying, "Oh, I could have done this differently," so it can be written in the first person. Is that allowed? Sort of saying, "I this," or does it have to be in the third person? Do you know what I mean? The actual style of it. Is that clear what I'm asking or not?
I think that's the difference of like the Veterinary Today magazine article and the scientific paper. And I don't think that it's something I don't know, and maybe you guys can about our graders be like, oh my God, they wrote it all in the first person. I do think it's more scientific, going, considerations that could have been made and making it a little more detracted, because you almost make it like it wasn't your case. I mean, I examined it like it wasn't my case, like I was reviewing someone else's case. I think I would say a lot of us want to, in the conclusion, say, this is what I learned. So, at the end going, I would do this, or this is, kind of how it affected me. But I think in general, the way I approached it was more outside of myself. But Diane, I don't know if you've seen both ways.
Yeah, I was going to say, I think it's been both ways, I think. And I'm thinking about that when it isn't your case, when you're commenting on somebody else's case, it's probably going to be in the third person. So I think it's acceptable either way. You just want it to be consistent, whichever one it is.
Okay, thank you. That's helpful. And the other question is, as far as case selection goes, and that's really useful to know that we can choose a retrospective case, or I don't have a huge caseload at the moment just due to my circumstance, and I'm operating as a small mobile vet with juggling other things. So I'm pretty confident I have a case and I can select a case. But does anyone who's done the paper before have a sort of any tips for what makes a good case, or is the point really you should theoretically be able to take any case and investigate and describe how it's been approached? And yeah, so even the most, what you consider maybe the most simplest of cases, it's the way you manage it and the way you explore that that's significant.
I mean, I think the obvious ones are things like, I mean, I did IBDD. There's diabetes, end-stage renal failure, end-stage cardiac, congestive heart failure. Those are very meaty. They have a lot of different parameters. They tend to extend long. I mean, I feel like we were doing one acute and one chronic. So I had one that lasted a year and one that was like a month. So, thinking through those disease processes, neurologic obviously tends to be very hospice. So I don't think there's like, oh, this isn't a disease process, you can do the case. I think sometimes when it's congestive heart failure and diabetes and kidney failure, I mean, there's a lot where it's good to show multimodal and multiple diseases, but if it's like one of those, like every single thing, I think that's going to be difficult to really do well or really get a hold on. So I would really, as a recommendation, try to stay in a very themed of what the disease process is. And if they have some outstanding ones, just add to it. But if it's like 17 million things going wrong, I just think that would be so hard.
Yeah. Okay, so it doesn't have to be a sort of particularly complex or unusual condition to
No, this isn't a case study of a zebra. This is an amazing thing I saw. I mean, it could be osteoarthritis and how you managed it, and that you found that this common treatment works really well. It's not about.
Yeah, that's what I'm sort of I'm getting at. Really, is it, can a case be too simple? But I guess then, I mean, reflecting on it as I'm speaking and thinking about this, like I mean, any case should receive the comprehensive gamut of the approach. I mean,
and any kind of literature search will be much harder if you have a 1 in a million case. Like if you have some, thing that only 1 in a million cats get, that's going to be really hard to research or to get kind of other thoughts. There's not going to be a lot out there, where if you're staying in more common diseases, I think that's very helpful. Now, if they haven't something unique, it would be interesting, I'm sure, for our graders and be exciting to read. But I think it makes you guys a little bit harder.
Heidi, I completely agree with you that cases like degenerative myelopathy, which is so common in an older dog, that's a very common type of the condition that a hospice practitioner would be involved with. It's not super complicated, but it certainly gives an opportunity to talk about all different ways that you'll be bringing in what you learned in the certification course into discussing the management of that case. I think a case like in a cat of a mandibular osteosarcoma, something like that, is another option. It's not, it's not comorbidities, but certainly in a case like that, there's lots of things you can bring in to discuss. And Regina, I see your question in the chat. You do not have to have been personally involved in the case. So if you're involved in a relationship with a practitioner, whether it's your case or you're a nurse and you've helped manage the case, if you could think back on a case that had a terminal diagnosis, it doesn't have to have been your case. You could just discuss it and do a really good job with it.
Just in relation to what Kate was saying, and just about having those cases that have multiple kind of comorbidities, do you even have to let you guys know that there's multiple comorbidities? Like if you're just kind of focusing on one kind of disease process, like, I don't know, in other specialties previously, I've been caught up in this, right? Where you think you've got this great case and then it does start to become really complex. And we were always kind of told, like, you don't have to give all of that information. Like, nobody really actually fully knows the whole history. And if you just want to focus on one thing to make your report much better, much focused. And so I'm just wondering, is that also an option through here? Like, do you actually have to address every single comorbidity the patient has in your report? I mean, obviously, as a veterinarian and as a technician who supports her vet, those are very important. But you only got 10 to 12 pages. So
I think you can make that choice. We don't, again, we're not grading the case and we're not asking for the case medical records to go with your paper so we can see everything. I probably, in my opinion, if I was doing it, I might write a little like there were other comorbidities, but in this paper, I'm not going to address them, just to put it out there, because if the case progresses oddly for that disease process, it may be like, why did you address this? Or why didn't you address this? And it, there may be a separate diagnosis. So I think some sort of call out that, these are other things, but the focus of this is on this disease process.
Mhm.
I was just wondering if you guys could talk about if we fail, so we submit our paper, if we don't pass, what the process is like for that. Do we have a chance to fix it or not? If that makes sense.
Well, Shannon, I don't know if I failed on my first attempt to submit my paper, but I was contacted by the reviewer who asked me if I could elaborate further on a particular thing that I had not covered sufficiently, and I don't remember now what it was. And it was at that time we didn't have a rubric that is as nicely broken down as the current rubric. So if you're following this rubric, it's going to be harder to actually leave out a section that should be covered because it's pretty laid out for you.
Mhm.
That we almost never fail anyone. I mean, I the only person I can remember was somebody that you basically didn't want to follow up and address any issues in her paper. So I want everybody here to realize that basically nobody fails the final. So stop with the anxiety, because I know I have test anxiety. It's an open book test. That the final is you're going to do just fine. And the paper too, I think that it's very easy to make it more complicated than it needs to be. And
if there's anything, you're not going to get an email saying F. You're going to get an email saying, hey, here are some, and can you alter it? Like if it's something like, it's going to be those instances where someone didn't try. And you guys are on this call. So like, I think the fact that you're on this call, meaning you're wanting, and then I think the other thing is going to be like, hey, these are some issues. Can you redo it? So it's going to be more of a revision or
Mhm.
request for revision. We don't right now. And I guess if it got severe, we would say like only so many revisions. But right now, I think it's a matter of just having a conversation and then making the adjustments.
That's right, Heidi. And Shannon, if that does happen, you have 2 weeks from the time that the paper is returned to you to revise it. And then it's sent to the grader again.
Do we have the option of turning it in early and then it being graded early so that we have more time for revision?
So they are due by June 15th, no later than June 15th. So, and we do ask that you have completed all 5 modules, 1 through 5, before submitting that paper. So that being said, yes, short answer, you can return it before June 15th. If you're already done with your modules, not a problem.
And then that way you would have a little bit more time to revise it. if you need to.
Absolutely. Absolutely.
And Mara, I was thinking when we're talking about the fact that you might be asked for a small revision, that if you have a vacation or time at work that's coming up and you're going to be really stressed if you're asked to revise it, one, it would be a good idea to try to get it in early so you have additional time to revise it. But let us know when you submit the paper. Send Danielle a message, because she can try to get your paper graded first in line as opposed to last in line for that
Okay.
particular grader, so that we can try to help you with the situation, that your time might be limited.
Yeah.
Yeah,
and
go ahead.
all graders are are active veterinarians. So it's not like we have people who are sitting in a cubicle who have no like, idea of the life of a veterinarian or a vet tech. So we're human, we're people, like just, it's about the communication. If you just don't respond and the last day you're like, oh, I had a vacation, that's not going to get as good a response as like, oh, I have 2 weeks, can I get it? I mean, even I work with a lot of state boards. You ask for a state board extension all the time and they grant them, so it's a matter of, just asking.
Got it. And then when it's completed, we email the report to, submission. I see it here. Okay.
Mhm. Yep. There's submission. It's the AHPC program at iahpc.org. And
Okay.
make
I
sure
think-
that you review those guidelines and make sure that your student member ID number is on the front page, not your name. That's how it's going to be assigned. And there's instructions on how to find that number at the bottom of the rubric. So
Case management section. What does IDT stand for?
that's interdisciplinary team. So other members
Okay.
of the team,
Oh, got it.
your techs, social workers, grief counselors, so on and so forth. Mhm.
Got it. Thank you.
Yeah, Amy has a great question in chat. It says, what about module 2, the communication module that she wouldn't be taking until in September? So great question. And what I believe is more important in the paper is modules, the recorded modules that you're watching, modules 1, 3, 4, 5. 2 is kind of an outlier because it's a live event and we can't hold you to not turning in your paper because that hasn't happened yet, the module, communication module. So is that correct, Diane?
And we don't actually critique, we don't ask for necessarily the communications that occurred when the visit is started, and whether you're using open-ended
Yes.
statements or whether you used empathetic statements correctly. So that has not been something that has been required before in paper. So Amy, that's not something you'll need to worry about. Kristen, I think the references that we asked for really are referencing things that back up some of the statements you make, and some of those references can even be back to a particular module. So that's an acceptable reference, but it's just if you bring something in that we may want to say, is this really accurate? Then we'd like to be able to go back and look to see if you shared correct information. Is that right, Heidi? It can even be referenced back to something that got in the program.
Yeah, I mean, I think that's fine. And it won't set up nicely in a footnote as much, probably an official scientific footnote. But yeah, I mean, I've referenced multiple different parts of the program, and it is helpful as kind of a review of what's in there. I would mention, as much as I know with scheduling, it's hard to do module 2 before your paper. I think if anyone is doing it at some, has done it, I do think it is valuable. It's not essential, but it is something that's valuable. So I don't want to just kind of move past it too quickly.
And also with module 2, it's also that specific content is not on the final exam either, just so you're aware that you don't have to worry about that on the final exam. That's not there yet. Melissa Underhill.
Again, just a quick question about the references. Actually, I may have missed this, but is there a specific format for how you want it referenced? I don't think I've seen that, but I could be blind.
No problem. Yeah. So at towards the bottom of the case report rubric, there are examples of the references, and it tells what they should be and how they should be laid out. And there are examples.
Okay, great. I think I might have missed that. Sorry. Thank you.
Nope, it's all the way at the bottom, and it's a reference. They're references, so they're a little jumbled looking.
And just as a little tidbit of information, there are websites that you can go. I'm going to say one of mine begins with citation. I can't remember the rest of the name of the website, but they can, you have a choice of different formats that are used in scientific journals, and it walks you through. It's a form that you fill out with the author and the date and the volume and the issue and all those things that you frequently see listed in references, and then it just spits it out for you into a format, so that can help you make that go.
And I put in the chat I literally Googled citing references. There's a million things online for it, and you know, we have our outlines, but there's a lot of different ways to do it. So this is just an informational.
And you know, something I did when I was when I first came on as chair, was I would get questions from students, and I started maybe not as early as this, but probably in about April of when papers were due in June, started to weekly send out a little update to everybody in the certification program. And what was really nice is when somebody sent me a question, I always felt that if that person had that question, the answer would probably benefit others. So we will make sure that if we get questions like that, Danielle will make sure that she shares those answers with everybody generally, because I want to encourage you guys to ask these kind of questions. So keep the questions coming, even if we don't have another one of these ways to connect virtually in a Zoom format, but just keep the questions coming, and then we'll make sure we get those questions answered. I think, Mara, if anybody's name is identified on an image, then you need to get permission from that owner. But if you can somehow use Photoshop or some other photo editing and be able to just black out the name, the image will be fine. And I don't think you have to go back to the patient. Do you agree with that, Heidi?
Yeah, for privacy standards, I would remove names. This is not something we publish. This is not something we put out there. I do think if this was something that we put out for others, but if we ever chose to put out an example or a case, it would have to be authorized by the client, because even just the scenario, unless it was really changed, is not appropriate to put out due to veterinary privacy laws. And privacy laws are different in every state, so we're not going to hunt all that down. I would just remove the names on any kind of images.
A common question that I've received by email is, we have some folks that don't work in practice or hospice practice, and maybe they don't really have much of a case to choose from, and they've been asked to be assigned a case. Can you shed any light on that, Heidi, Diane, about how that would work if someone did not have a case, or we can follow up with them at a later time?
I'm pretty sure I think I came up with a sample case that I had sent those students.
Okay.
So we can look through our files and make sure we have available sample
Sure.
cases. But my hope would be that you could chat with a colleague and know enough people that you could find a case. Remember, they don't have to be that complicated. And unfortunately, many of our patients will be going through their end of life journeys. So there should be plenty to look at and comment on how they were hopefully well managed, or where management could have been improved.
And this could be a case from 5 years ago, or critiquing our own work. So I would imagine there would be some end of life, no matter if you were working, unless you really came through research. But I think there are things where you can think back to a case you had, and you might have not done anything for it and work through, but there are some sample cases. There's always been sample cases available. Now, assigning, like, you are doing this case, we can have that sample case for you to do, but I don't think we're going to talk to an individual person and say you must do this case. So
Okay, great. And you can write about your own pet.
Yeah.
As long as it's and the right person. Of course, you can email me, as always, with anything that you come up with after this. We recorded everything, and so I'll send the link out by email to everyone, so you can reference back to it if you need to. Thanks,
thank
Melissa.
you, everyone. Thank you, everyone, for joining. This is fabulous.
Absolutely.
I'm so happy with the engagement and that you guys took the time to learn more. I always worry when students are just sitting there struggling and not asking for questions or not asking for help. We're here. If you need to reach us offline and you want to reach out, we're totally available for, whether it's just comfort that it's all going to be okay. or those sorts of things. So really, and if you see these people's names and you can connect in some communities, to also kind of connect, that would be huge, because it does make a big difference.
Thank you so much, Heidi and Diane, for helping with this today. So very helpful.
Have a great rest of Friday and have a great weekend.
Bye, everyone.